When we look at adherence failures in seasonal allergic rhinitis, we often assume the problem lies in efficacy, trust, or prescribing behavior. In reality, it doesn't. The problem begins with timing. Most families start treatment only after symptoms have already peaked. That means early relief feels slower, confidence builds unevenly, and by the time week 4 arrives, continuation no longer feels necessary. Clinically, 4 weeks is just a minimum review point. Behaviorally, it feels like the end of treatment. And when there is no structure to guide the parent, their interpretation always wins. That is why week 4 has become such a consistent breaking point across brands. Early symptom relief unintentionally reinforces this behavior. Parents see improvement and assume the job is done. Safety concerns then surface later, often online, without clinical context. And once the family leaves the clinic, there is typically no reinforcement to steady them through these transitions. This is not dissatisfaction or resistance, it is unmanaged behavior, which is why better campaigns or louder messaging do not solve the problem. For this, what works is restructuring the journey itself. Effective systems move initiation earlier, before symptoms peak. They frame expectations clearly at the start, positioning week 4 as a review, not a stopping point. They provide safety context before parents encounter fear online, and they reinforce guidance after the visit exactly when behavior normally drifts. Nothing about the molecule changes or the message changes, but the experience becomes easier to follow. And when the experience aligns with clinical intent, continuation stabilizes naturally. That's really the change seasonal brands need to make, moving away from persuasion and towards precision, away from communication alone and towards behavior design. Because growth isn't driven by what we tell people, it's driven by whether the journey makes sense and holds together from start to finish.